So there's a lot of weight fluctuation, but I would say the main symptom is that every single practitioner should be asking you, TRT is the new Botox, because...
So who are you and what the hell are you doing here?
What the hell am I doing here? I am Dr. Amie, aka the Thyroid Fixer, and I am here to fix broken thyroids and broken hormones to give people a better life.
Listen, thyroids seem to be an issue, and one of the things I've realized is that I feel like it's a woman, female-centric thing. Correct me on that.
No, you are correct. Thyroid disease mainly hits women. About 95% of all hypothyroidism hits women more than men because men have higher testosterone levels than we do. And testosterone is incredibly protective for the thyroid gland. And it's incredibly protective against autoimmunity as well. So you guys get that extra layer of protection with your testosterone that we don't get.
Okay. So are women with optimized hormones actually hotter, smarter, more successful? Because that seems like what your PR is pushing.
Hell yes, they absolutely are. I call it optimization land. And this is where you live in this state of high energy, focus, brain function is at the very top. Everyone's making more money. They're doing businesses, they're starting businesses. They're not gaining weight looking sideways at a brownie. They get to poop every day, so that's a win for detox. It's an incredible place
I didn't
to
think
be.
women ever pooped.
Well, it's a little secret that we don't let you guys in.
Oh, okay, I was I've always wondered about that.
Just for detox purposes. That's
Okay,
it.
okay. So let's be honest. Can you look at somebody and tell that their thyroid is fucked up?
Sometimes you can. So the classic sign, I'll see this thickening around the neck. And then if you know a woman whose weight really fluctuates, like, oh my gosh, I saw her 2 weeks ago and she was 15 pounds less than she is right now. And how did she gain all this weight? Oh my gosh. That is classic thyroid, dark circles under the eyes, any kind of water retention, like that moon face, thickening of the skin. You can see it.
So thyroid issues don't just move in the one direction of keep gaining weight. It can actually go back and forth.
Well, what women will do is they're rapidly gaining weight because they have a thyroid problem. Maybe they know it, maybe they don't know it. Maybe they know it and they're on medication, but it's not the right medication for them.
Mm.
And the scale's going up. So this is what happened to me. I was competing. I was doing all the things. I was eating chicken, broccoli, asparagus, fish, and the scale kept going up, 25 plus pounds. So that scale goes up. What do, especially as a woman? You eat less and you exercise more. So these women will starve themselves. They'll go to the gym 3 times a day, take an extra spin class. And yeah, okay, for a short time, their body will release that fat and go down. And then the thyroid eventually says, yeah, sorry, you don't have a metabolism. Boom, scale goes back up again. So there's a lot of weight fluctuation, but I would say the main symptom is that weight gain and inability to lose weight. No matter what you do, no matter how perfect your diet and exercise regimen is, scale's not going down.
So let's talk about one person, one problem, one solution. How would I know that I have a thyroid issue, or what are the telltale signs?
Test, don't guess plus symptoms. So you take your symptoms, right? So you have the weight gain, the fatigue, the hair loss, the constipation, the dry skin, the brain fog, any of those symptoms. Do you have some of those symptoms? Okay, yes. Now let's go over here and test. Now we do that full thyroid panel with all the tests that actually give us the right information on your thyroid, not just TSH. So you go to conventional medicine, you're just getting TSH. That's it. You need TSH, free T4, free T3, reverse T3, and then the TPO and TGA antibodies to get that full picture of your thyroid.
Okay, so you're talking about conventional medicine. Why are conventional doctors keeping women fat, tired, and infertile?
Yeah, that's all they've learned. So they are taught in med school that you test one thing, that TSH. If TSH is above a 4.5, you give T4 medication, Synthroid, Levo, pat them on the ass, wish them luck as you kick them out the door, and we'll see you in 6 months. That is the standard of care in conventional medicine. That is what they have learned. Years ago, I gave a talk to integrative wellness physicians, and I said this to these guys. I said, listen, we need to be testing thoroughly, and we need to get out of what I call the Synthroid box, meaning you're putting everyone on the same thyroid medication, the same thing over and over again. If someone walked into your office and they were depressed, you would try 5 different antidepressants, throw on a benzo and a sleeping pill until you found that right combination for them. Someone that's fat, frustrated, infertile, you give them one pill and you expect that to do the job. Why is that? And then one doc raises his hand and goes, that's all we've learned. So that's all they are learning, unfortunately.
So do you think listen, we're humans, we're intelligent, we grow, we think, we investigate. I know personally many women that were gaining weight, went to doctors. There's nothing wrong with your thyroid. You must just be eating like shit or you're just a fat, lazy piece of crap.
Yes.
So every doctor is just sitting there being like, okay, I'm going to be a fucking idiot and never investigate how this is going. And then yet all those women I'm speaking about, eventually I sent them to non-conventional doctors. They found out, however, I don't know what the testing was, that they did have a thyroid problem. So are we lazy MDs or are we just padding the system trying to get rich off of it?
A little bit of both. A little bit of both. So the lazy MD thing, and I don't want to bash every medical doctor out there, right? But the bottom line is they are run by the insurance companies. Insurance says you have a 5 to 7 minute visit with this person, and don't you dare test more than what we tell you that you can test for. And if you get certain markers back, these are the drugs that you're going to give this person. And doctors really are pressured to fall into that insurance model and please the insurance gods. So there's a little bit of that. I don't think that they're lazy. I think they're being controlled. And then we do have big pharma. Big pharma is funding the medical schools. Now, let me back up. I am not anti-medication. I believe that there is a time and a place for thyroid hormone replacement. I mean, we do it in our clinic, right? I want you to have the right thyroid hormones. I want you to have the right sex hormones. Let's do BHRT as well. The problem is in that same model of put everyone on the same thing, it's not gonna work. Thyroid and hormones are nuanced. It's a nuanced art. You have to meet that person where they are. You have to optimize them due to their biochemistry, not something that's textbook that you're just following this little chart and treating people with standard of care because you gotta get them out of your office in 5 minutes.
So you mentioned hormone replacement. What's the most unethical or like scammy thing you see going on?
The pop-up clinics. The online pop-up clinics that they yes, we are getting more focus on hormone therapy these days, thank God, for men and women, thank God. But the problem is these pop-up clinics are popping up everywhere, and people will go online for $129 a month. They're not getting tested. They're not being guided. Everybody's being put on the same hormone replacement protocol. And again, hormones are nuanced. I mean, even as a dude, you need the right amount of testosterone to get your testosterone to where it should be in that optimal range. Well, if we give you too much, you're going to rage and break out and not have a fun life. And if we give you too little, that's going to shut down your own testosterone production. It's about that nuanced art of fitting the treatment protocol for you.
So, at the foundation of this, we're an anti-aging channel, right? And I learned years ago that I was hanging out with older dudes, 60, 70, whatever, and they were in good shape and they're like banging out girls all the time and stuff. And then all of a sudden, one of them said like, "Oh yeah, we're on TRT."
Yeah.
And every dude was on TRT, and I was like, "Holy shit!" Right? And to me, that was like one of the foundations of aging, right? I'm almost 50. You hit this point where your glutathione isn't getting produced, you have no testosterone, on and on and on, all these things. And I think that's probably the first stage, right? So, when you look at all these influencers, they're pushing peptides, but they're ignoring hormone balance. What's your take on that? Are they frauds?
Oh, I just love you for answering that or asking that question. Can't believe you're a
You knew we were going to get along, right?
I know, I did. I knew from the beginning we were gonna get along.
Yeah. One asshole knows another asshole, right?
It's so true. Oh my gosh, and just straightforward, no bullshit
Yeah.
assholes, so that's what we are. Um,
But that's it. That's it. This is why we're in this position, right?
that
I'm going to ask the hard fucking questions and you're going to answer them the right way. And that's all it is.
I love it. I love it. So, I think we are missing the mark with peptides. Again, we're getting this focus on groundbreaking stuff, biohacking stuff like peptides. But then it's almost like the peptides come in and take over, and we lose focus over here on the hormones that give us life, the hormones that anti-age us, the hormones that protect us against the disease of aging. We can't solve everything with a peptide. It's a tool. It should be a tool that gets pulled out of the tool chest and thrown in along with the other tools, along with the hormones and the lifestyle and all the things.
I'm glad you said that. Because I think aging, health, everything, it's a universe. It's just not one piece. So what's the one truth about aging that the mainstream media doesn't really want people to hear about?
That you don't have to age and like throw in the towel and go, okay, well, I'm 50. So at this point, I guess I'm going to just hunch over and not walk straight and lose all my hair and not want to have sex ever again and throw on a diaper because I'm incontinent. Fuck that. Absolutely not. We don't have to fall into society's plan of aging. And we see a lot of people fall into that.
So why are they selling this narrative?
Honestly, big pharma, right? So let's take that average human being on the standard American diet. I guarantee you by the time that they hit our age, they're going to be on a statin, a blood pressure medication, an
One of your
antidepressant
thyroid?
for sure. Oh, yeah. And they're going to wear a CGM because they're actually diabetic. So they're going to be on metformin as well. Probably be 50 pounds overweight, losing their hair, no quality of life, but that's all they know. They're just going to keep taking those pharmaceuticals because their doctor said, this is what you need, Jerry. This is what you need to take every single day, Sally. And they fall into what they put their doctors on a pedestal and treat them like God. And then anything the doctor says, they follow. Meanwhile, they don't even realize that the doctor is getting a kickback from all of those scripts that they're writing you.
So is the doctor doing this to get rich, or is it malpractice, or
Honestly, I think it comes back to the insurance. It's the insurance company dictating. It's like, where follow the money trail.
why can't we push back against the insurance?
Well, we can just by taking health into our own hands. I mean, this is where functional and integrated medicine comes in. Like, yeah, you might not be able to use your insurance to cover that visit. You might have to pay that doctor out of pocket. But guess what? Instead of a 5 to 7 minute visit, you're going to get a 60 to 90 minute visit. And they're actually going to give a shit about your health and how you feel. They're going to ask you those four most important words that every single practitioner should be asking you. How do you feel? And if you don't hear that out of your doctor, your nurse, your OB/GYN, whoever you're working with, you turn around and leave because they don't give a shit. They don't care.
Why don't you, I like that you said that. So we're allowed to switch doctors? Why do people get crappy, you know, attention from their doctor and continue to see these people?
Oh gosh, that's a $1,000,000 question right there. I don't know. I don't know whether it's just that what we grew up learning, that you have that family doctor and you stick with them and you've been with them forever, so it doesn't matter how they're treating you. I don't know. It's a weird mindset, but people
Maybe
have
the
to,
doctor knows more. Maybe the doctor's a delicate genius. I mean, at least
right?
that's like the household I grew up in.
Yes. Yeah, and I think it was passed down. Grandparents,
Yeah.
parents, like, you respect your doctor. I mean, they are, again, put on a pedestal. Now, should they be? Listen, somebody had to come in last in medical school, right? I mean, you don't know if you're with the first in the class or last in the class, but is that doctor expanding his knowledge, his or her knowledge? Are they breaking outside of what they learned in medical school, which after a doctor leaves medical school, 80% of what they learn becomes obsolete in the first 5 years. So are you actually breaking out and learning more to better help your patients? And if a practitioner is not doing that, shame on them. You shouldn't be with them.
I mean, I ask this question to every doctor I interview. So how do you find a good doctor?
Mm. So I would say, first of all, you ask around and you look at, do you have a friend that, oh my gosh, she's taking this stuff called estrogen and progesterone and testosterone and she looks amazing and she's my age and she looks great. She looks like 10 years younger.
I should do what Keith Richards is doing?
Right. Exactly. Right. And maybe we don't go as far as like Brian Johnson, but we look to people that are doing it right, and we go, "Hey, what are you doing? Who are you seeing?" Now, again, it might not be the doctor in your town. You might not be able to go down the street and walk into an office, but these days, things are virtual, and you can get high quality care with virtual health.
So back to hormones. So is everybody over 40 just a walking hormone hell?
Pretty much. So I coined the phrase thyropause in my role with thyroid because we heard perimenopause, menopause, even andropause for the dudes. But thyropause, my definition is when the thyroid gland shits the bed after the age of 40 due to fluctuating hormones. Because we have these fluctuating hormones. Nobody's aging like Benjamin Button. No one is going to move forward in the years.
You and I are.
I think we are, though. I think we found something. But most people are not moving forward in years and building new hormones. Like your hormone levels aren't going up. So realizing that you will lose hormones, hormones give us life. Let's replace those. I mean, it's the key to anti-aging. Before the peptides, before the supplements, before the sleep hacks and the devices and the red light and the sauna, start with freaking hormones because they literally give you life.
I agree with you on that. So if you had 90 seconds to biohack someone into looking and feeling 10 years younger, what would you do?
I would test their thyroid, I would test their hormones, and I would absolutely optimize those first because, again, that's the anchor. That's the core, that's the anchor, and then we go outside of that after I get that done in the first 20 seconds. We would go outside of that, and then I would say, "Are you sleeping? Are you sleeping?" Because that is the cornerstone of everything. So let's get the hormones, the thyroid optimized. Now let's make sure you're getting that high quality sleep because nothing's gonna work if you're not. And then let's look at other blood markers to see, are you insulin resistant? Are you inflamed? Like, what else do we have to do to your body? Just little levers that we can pull that makes a huge difference in how you look, feel, and perform.
Okay. So we live in a world where I feel like we stack shit, good stuff on top of shit all day long. So, we're talking about optimizing hormones here. Is that really effective without fixing the system first or, correcting, you know, our eating habits and our lifestyles and all this other stuff, because I feel like it's putting like premium gas in like a blown engine, right?
Yes, yes, I agree with you. So when we start using hormones, that's where the lifestyle has to come in as well. It's this both and theory where, okay, maybe over here we can't just take a 55-year-old and say, well, now you need to sleep and don't eat processed food and take out the sugar and all of that. They're like, yeah, 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 I've done that. And it's not helping. Right now that you've done all of that, now we can come over here and do the hormones. Or if we're doing the hormones and we ask you, like, hey, are you treating your body like a circus? Are you going to McDonald's? Are you not sleeping? You're staying up late? Okay, this isn't gonna work then. It has to be both together. To your point, it has to be both together.
So could we say that this isn't really a fit for everybody then? Because we know a lot of people just want to go in and get a Lipitor or whatever it is.
Well, yeah, it's about mindset. So yeah, the type B sheeple out there is probably not for them. And we need them walking around the earth, living their life how they want to live it. It's all about choice. It's all about choice. If you want a high quality of life, then you're going to do all the things to get that. And if you want to succumb to the way that your parents and grandparents aged and be hunched over and die early and get dementia and cancer and all the things and lose all your hair and have osteoporosis and break a bone and break a hip, then yeah, that's your choice. It's all about choice. How do you ultimately want to live your life, quality of life, and how do you want to die?
I mean, I think it's an interesting statement that you're making because, at a young age, I was always optimizing, right? I never drank alcohol. I didn't do a lot of the things that you do in that young age because I was looked at it because I just didn't want to. I've always been living for retirement, as creepy and shitty as that sounds. And I remember, my father has no hair, he's bald, and he was a pro athlete. And by 40, he had, like, hip replacements, all this other shit. He was a disaster getting fat and whatever, and I thought to myself, "Wow," I was like, "That sucks," right? Because if you look at life on a delta and you say, "Okay, life is between 18 and 40," it's a pretty short life.
Right.
I mean, I think between 18 and 90 is a pretty short life, but this is even worse. So, I always had that mindset early on. But most Americans don't, they don't worry about it until, like you said, they're losing their hair, they're overweight, Is there a way to really crawl back from all that? Or you just give up and if you're fat and bald and blind at 40, just fucking get on the drugs?
No, no, we can absolutely come back from that. I mean, that's really what I see in my practice every day, right? We have the women and the men that have been in the conventional system and they've been disappointed enough and that little bell goes off in their head that goes, "You know what? Something isn't right here. I'm not being treated properly. I think there's more. I think I can feel better." And then they start exploring, and that's how they come into this biohacking world, functional medicine, integrated medicine, because they realize there are answers out there that somebody's not giving them. And they start searching for those answers and becoming their own advocate in this healthcare system. We can absolutely take someone from that balding, losing hair, gaining weight, can't think, fatigue place back to that optimized state. It's never too late. I have patients in their 70s and 80s that haven't been on hormones since literally like their 40s and they lost since they lost their hormones. And we start replacing them and they thrive because they're like, I don't want to live, even if the rest of my life is 2 to 5 years, I want to live it the best I possibly can. And kudos to them.
So, moving on onto that, are we reversing aging or just slowing it down?
That's a great question. I think a little bit of both. I think we're slowing it down and we can get some reversal. Listen, we're all aging. We're all aging. I mean, I don't think anyone has found the key to stop death from coming. It's going to happen, but we can live a higher quality of life through those years, and we don't have to suffer with the symptoms of aging.
So it's more about longevity than longer life.
Right. Right. And that's always been my take too. I've always made fun of Dave Asprey. I'm like, Dave,
Mm.
I don't want to live to 120. I want to live to 90 looking like Sophia Loren and being a badass and skiing down the side of a mountain.
I always thought the same thing. If I could like die looking like this, acting like this at 90, I'd be,
I'll take it.
yeah, you take it,
Yep.
right? Um, so do you think most doctors even know what optimal aging looks like, or are they just managing decay?
Managing decay. Absolutely. My sister's a conventional doctor, and I see how she lives and how she is aged, and she's fallen into the conventional medicine way of thinking, and that's what they've been trained to do. And unfortunately, they get sucked into their own training. I mean, it's very, very rare that you will find a conventionally trained doctor that really breaks out and goes, "Hey, we're not treating patients right. I think we need to do something different." Because if they speak up, they're getting their funding cut off. I mean, really, they have to go out on their own and make their own money doing that if they're preaching that message.
So why didn't you take that path? Same household, same parents.
Yeah, I think it's because from a very early age, I was always a fat kid.
Wow.
And my dad's side of the family had insulin resistance, diabetes, so I battled that very, very young.
How long
I
now with that?
Oh, fantastic.
Really?
I've optimized too.
Really? And you're not on any you filled in the blank?
No, I mean, I do thyroid, I do hormones, I microdose in GLP more because I have Alzheimer's in my family, and that's fantastic for optimization of the brain. But my insulin and A1C have been perfect for years, so I definitely avoided that. But that's really what catapulted me in a very young age to get into the health space. And then I was competing in bodybuilding and fitness competitions, doing fitness modeling. That's when the weight started coming on and I was misdiagnosed 6 times, had a thyroid problem, was walking around with a thyroid problem, that's what caused the weight gain, and 6 different conventional docs said, "You're normal, everything is fine." So after experiencing that, I was like, "Screw this, like, this is not the way that medicine should be and that people should be treated."
So one of the takeaways from that, and I want you to speak to the audience about this, because so many people get diagnosed and they just accept it. So what's your take?
Well, you that diagnosis is just it's just a gift given to you. Like, your symptoms, I say, are a gift by your body to say, "Hey, pay attention to me, please. There's something going on that you need to dig into." But then that diagnosis, when I got my diagnosis, I was like, yes, now I have a name for what the hell's going on in my body." So use that diagnosis. Don't let it define you, but use that as a springboard to now find answers. Okay, now I have a name for what the hell's going on. Now what do I do? And you as the patient have to break outside of the conventional model and look at, people like myself and everybody else out there speaking in this biohacking space, the hormone space, and get all the information you can so that you can make the best choice for you.
I like how you say that because, I was sick as a child, and that's what motivated me to be healthy at a young age, would put me here today. And as opposed to using it as a crutch or, "Oh, look at me, I'm a minority, I'm this or that, I'm oppressed." I said, "Fuck this, I'm gonna put it on its ass,"
Yeah.
right? And then use that as a strength more than anything else. And it is a blessing in disguise because I'd probably be fat and bald right now if I wasn't sick at a young age because I would have just followed the same conventional path of every other person.
Yeah.
So, okay, you can only pick one. Thyroid meds or peptides?
Thyroid meds
Okay.
all day. Yeah, because here's the thing. If your thyroid gland is not producing the right amount of thyroid hormone, and the thyroid is the master gland, it runs your brain, it runs your metabolism, it runs whether or not it dictates whether or not you poop every day, it runs everything head to toe. If that isn't working, it doesn't matter how many peptides and supplements and workout regimens and food and even hormones that we throw at you. You have to start at the top. You have to start with that master gland.
Excellent. Most overrated anti-aging trend, and you can't say Brian Johnson.
Damn it. That's what I was going to say. Oh, the vibration plate. I would say that's the most goofy thing that
Interesting.
I see, yeah. I just can't find any science backing that exactly. At least we have science for red light. We have science for the sauna, cold plunge, all of that. I mean, even peptides are awesome when used properly. But why the hell are we standing on a vibration plate? Maybe I don't know.
Well, it's funny that you said that because those guys come on the show all the time and they try to convince me that there's science behind it. And they say the New York Giants use it and all this stuff. And I haven't like gotten that deep into it to really look. But yeah, it seemed like bullshit to me too. But and they say, oh, you just stand on there and it just vibrates and it vibrates your muscles so you don't have to do a workout or it intensifies the workout you do. So, I'm not about the free lunch, so I don't know if that
I'm
makes a
gonna
lot.
throw that question back to you. What do you think?
I haven't used it enough. I'm really like a data-driven guy, like
Okay.
you're saying,
Yeah.
right? So I look at data. I don't, there's always a saying that like I believe, nothing of what I hear and half of what I see. So I've tried it. I've done push-ups on it, whatever. I haven't used it enough to make a determination.
So what's the biggest anti-aging hack though that you've done? Same question back to you.
Oh, the biggest thing, so it's not one, but it's a little bit of, so testing, hormone replacement, and with hormone replacement, like, because there are other things that are not hormone replacement that your body needs, again,
Right.
glutathione and whatever else you want to talk about. So I think that's it. Testing and hormone replacement
Okay.
is the biggest thing. And because I look at aging as a system breaking down. And when I see that I'm not producing testosterone, let's say, that means something isn't working. Now I can't, maybe I can I'd rather fix the testosterone machine than take the testosterone. But I know my body, when I felt great at 25, I had those things.
Yeah.
So I want to have those things still.
Yeah.
So I think that really is the first step. And like you said, I don't think it's going to stop aging, but I think it's going to slow it down.
Mhm.
Um, and I think the biggest bullshit to a certain degree, and a lot of people disagree with me, are things like, I don't like Botox and fillers, right?
Okay.
Because, when people think we're anti-aging, I was like, we're not Botox and fillers. We're like fundamental understanding of health, then hormone replacement, then the other, magic.
Yeah.
Um, and what I think is really important to understand is that there are upsides and downsides. Like I was watching a show yesterday where they said that 14 to 20-year-olds are getting Botox to prevent. And because of that, they're having muscle atrophy, and then they're getting wrinkles in places that they would have never had before. And this is the stuff, right? Like I haven't done Botox yet. I haven't done fillers or things like that, but I know, I'll be open to it when the time comes, most likely.
Mhm.
But I don't know. We'll see. But that, again, it's the misinformation around that shit,
Yeah.
right?
That's
Because would you tell your 15-year-old daughter or son or whatever to, right? And in this thing, there was like, oh, well, Kylie Jenner was getting, facial treatment at 15 and now she's having issues with it. So listen, I want to be beautiful forever.
right.
Right. Although I was never beautiful to begin with, but the
You look like you're 25.
thank you.
Seriously.
Thank you.
Yeah.
I used to say it was like not having a kid and not having a job, but now I have a kid. So I don't know, maybe I'm starting to age, who knows? Um, but the truth is like, it's a misinformation. I mean, the premise of this show is to democratize health information. I didn't ask you any easy questions today,
No, I love it.
right? Because I want to sift through the scumbags
Yep.
and the real people that are here to health first and profit second.
Yeah.
Right. And I feel that you have that. And, we did a lot of research on you. You wouldn't even be sitting there if you passed most of those tests.
Yeah.
And I love the personality because I can come at you
Yeah.
and you can come back at me. And most people don't ask me questions. So I appreciate that.
I'm gonna have you on my podcast.
Let's do it. Let's do it. I have like, I may not have an interesting story, but like I said, I was sick at 6 months old, right? My entire life, I have like 6 or 7 autoimmune disorders. I have psoriasis, psoriatic arthritis, ulcerative colitis. I mean, I can go on and on and on. And I mean, if you look at me, right, I can run after my 6-year-old. I can chase him, right? I was in a wheelchair. Like I said, we're not talking about me here, but I can give you some stuff.
Oh damn, yeah.
Um,
Your story. Yeah.
so let's get back to you though. So what's one supplement you never take?
Never take.
Yeah.
Hold on, you gotta give me a minute here. Because my supplement pantry is like a store in there.
Well, let's switch the question. So your supplement pantry is a store. Can I take all your supplements?
Yes, you could.
Yeah.
Well, you could take everything in my line.
Should I?
No.
That's
No.
what I'm getting at.
Okay.
Pull that thread.
So I own a supplement company and I still do not believe in people loading their bodies down with supplements. We'll get patients in the door that come in with their bags or a list 2, 3 pages long of all these supplements that they're taking. And then I'll ask them, "Do you know why you're taking that?" They go, "No, I just saw it on an Instagram commercial or my doctor told me to take it." They don't know the quality, they don't know what it's doing in their body, they don't know the interactions with all the other supplements they're taking. So no, I am actually not a big believer in loading your body down with supplements. I have a saying called the no duh supplements, like duh, of course you're gonna take them every day.
So give me the no dose.
The no does are vitamin D, magnesium, selenium for the thyroid, but I always also tell people just eat a Brazil nut. I love iodine. I know that's very controversial, but I am pro iodine, so I
Why is it
believe in that.
controversial? I think it's we should have it.
Oh, iodine. You have about 50, maybe 40% of functional practitioners saying don't use iodine because it might cause a thyroid storm. And then we have about 60% of us going, well, no, wait, let's use common sense and data. Let's look at what is iodine. Iodine is antiviral, antibacterial, antifungal. It's needed by your thyroid gland to produce the two thyroid hormones. It's needed to convert that inactive thyroid hormone to active thyroid hormone. It helps with fibrocystic breast disease. It helps with fibroids. It helps with cancer. Why in the hell would we not be taking that every day on the off chance that some idiot is going to take too much and have a thyroid storm or go hyperthyroid? I always tell patients, listen, you're going to know the day that you take too much iodine, you're going to feel like you drank 10 Red Bulls. Don't worry, it'll pass. Take some vitamin C, add some salt, and don't do that dose the next day.
So tell us how deficient we are with iodine in society.
So we're hugely deficient. That's why the government tried to put it into our salt. But that didn't work. It wasn't the right form of iodine. So when we actually take the right form of iodine, here's the thing. If you look at, again, data and common sense, look at the periodic table. We have iodine, we have fluoride, we have bromide and chlorine. Those are called halides. Now, we're all exposed to chlorine every day unless you have a whole house water filtration system and never drink anything outside of your house. We're exposed to bromide, clothing, carpeting. If you live near a golf course, it's everywhere. And guess what? Fluoride's in our water. And if you haven't changed out your fluoride toothpaste, shame on you. So those halides will attach to a receptor site on your cell. The only thing that will push out those toxic halides, hugely toxic for the thyroid, the only thing is iodine, because iodine will compete at that cell receptor site to attach. So the only thing that can come in and push out those halides that you can detox from chlorine, bromide, fluoride is iodine. Why would we avoid it?
Thank you.
Yeah.
I want a sound clip, so let's go back. Give me the no dose.
The no dust supplements, vitamin D, magnesium, iodine, and I even add in black cumin seed oil. Black cumin seed oil, especially for you with your autoimmunity, it lowers all antibodies across the board for autoimmune. It lowers inflammation, and it is one of the only ingredients, only supplements that we can say, in addition to iodine, is anti-cancer, because there are studies backing it that it lowers your risk of cancer.
Awesome. Best soundbite ever. What's one hormone everyone should check at 25? And if not 25, what age?
Ooh. One hormone everyone should check at 25 would be your thyroid as well. Full thyroid panel, all thyroid hormones, T4 and T3, so that we can see where you're at, and your TPO and TGA antibodies. Let's check for autoimmune, because autoimmune, that switch turns on during any point of time of stress or hormonal change. So we can even go back to a person's teens, puberty, huge hormonal fluctuation that can flip the switch to autoimmunity. Now you're in your 20s, now you're getting married, having kids, moving, different job, huge amounts of stress. Now you got to make money, you're on your own. Boop. There's that switch for autoimmunity. So let's check your thyroid, check that TPO and TGA antibody marker to see if your autoimmune is turned on.
Wow. 40.
40 is progesterone, testosterone. Because for a woman, her progesterone levels will start to decline in her 20s, 30s, definitely by 40. So that's the first hormone to go. And the classic sign of low progesterone is when a woman says, you know, everyone in my family is asking me why I'm so bitchy all of a sudden. I'm like, yeah, you have low progesterone. So we check progesterone, then we check testosterone. So that's across the board, male and female. After you crest that 40, testosterone starts to decline. It's not coming back. So let's check it and get you to the optimal range.
50.
50 is all the hormones. So now we're continuing to check your thyroid. You should be checking that every decade of your life. Now, once most women hit 50, they're in menopause. So now it's time to bring in the estrogen component. So your progesterone and testosterone are already tanked. We got you on those. We're optimizing that. And then all of a sudden, oh, wait, now my vagina's drying up and I'm having hot flashes. Okay, ladies, let's check that estradiol number because maybe it might be time to bring in that hormone.
Wow, you have a fix for everything.
I do.
I mean, it's important. That's why you're here. Um, what's the biggest lie in endocrinology?
The biggest lie in endocrinology is that you don't need T3. So when we're looking at the thyroid gland, there's two thyroid hormones. I mentioned it earlier, T4, T3. T4 is inactive, T3 is active. So the only thing that can attach to your cell and do its job and give you metabolism and grow your hair and light up your brain is T3. Every single endocrinologist I have ever run into says, "Oh, you don't need T3. It's not important." Oh, as if all of us are walking around metabolically beautiful and you think that we're going to convert that inactive thyroid hormone to active. No, that conversion process is like running 10 Tough Mudders for your body. There are so many things that can interfere with it. So we want to make sure that we check your conversion and use T3 if we need to, because that'll give you life.
Is TRT the new Botox?
Oh, I think it is. TRT is the new Botox because if we actually optimize your hormones, you're not going to wrinkle like your average person who has declining hormones. I always say, look at old lady hair, look at your grandma, right? She got the perm, she got the gray, but you can literally see her scalp. And that is from loss of hormones. Your voice, your voice starts to age. I interviewed a woman who was 75 and I go, I wouldn't even know your voice hasn't changed. She goes, hormones.
Really?
Mm.
Wow, wow. How many years can hormone optimization really add to your life?
Oh, I believe it can add decades to your life. Because if we are reducing our risk of Alzheimer's by 67% by adding in estrogen, we're reducing osteoporosis by adding in estrogen and progesterone. We're protecting your cardiovascular system by adding in testosterone and protecting your muscle, the organ of longevity, 10, 20, 30 years, easily.
Fuck, incredible. Worse for aging, sugar or unbalanced hormones?
Fuck. Damn it. It's about 50-50.
Okay.
It's 50-50.
Okay. One anti-aging secret you only tell your VIP clients.
Oh, that's a tough one. I tell everybody everything, that's the thing. I would say for my VIP clients, we do go down that peptide rabbit hole because there are so many different peptides we can use to really raise that bar. So instead of using growth hormone that can spur on cancer, let's use the growth hormone peptides. Let's use CJC, ipamorelin, tesamorelin. I think those are kind of a higher level anti-aging protocol that only your VIPs are really down with,
Yeah.
but we take our people to that level.